of exposure in variety of hospitals and industrial sectors. So I won't take it much long. Now we'll start with our uh, alumni talk, or with our talk. We have today with us Dr. Ishan. He's now practicing with NHS in UK. He is an alumni of Institute of Health Science, and we are proud of it. He is basically from Western Odisha, and he has a very beautiful journey to describe to you from Western Odisha to IHS and then to UK now, where he is working upon. Now, I would request you, sir, to be kind enough and tell your journey to all our students and the participants who have been associated with us today for this session. Thank you, sir, for coming. And now I would give you the opportunity to talk about your journey in detail to inspire our students.
Right.
Up
Thanks,
to you,
Priya.
sir, now.
Yeah. Um, um, yeah, I know most of my juniors, I can see them online. I think they know what I am. But anyway, um, yeah, as he said, like I'm from Western Odisha, exactly from both one of the Western district. And yeah, basically, I spent my pre-graduation more in studies. Just it was more focused on studies, not on extracurricular activities and stuff. But yeah, in 27, uh, my dad actually after finishing my PhD, I was preparing for entrance exam for engineering and medical course. My dad approached me and told me, showed me in the newspaper that advertisement has posted, uh, for the physiotherapy course. He said, yeah, this is exciting opportunity. I just blindly followed him and went for this entrance exam IMAT. So I wrote the exam, then yeah, within fraction of months, like started the course. So that's the first time like I moved to Bhubaneswar. I left my home. Yeah, after coming there, like my first experience was with my very good uh, but my batchmates. Uh, it was very good um, then. So one thing it motivated me and made me feel like, yeah, I'm in a right place was my staffs. So during my first year, Dr. Devasis was there. He was the head of the had lecture. Dr. Um, Raj Sekhar. They were all geniuses, according to me. Like any problem, anything, they will resolve. Like any doubt I have regarding any subject, uh, they were like right away they were like clearing it out. So that kind of inspired me. Then I was thinking like, okay, the person's like at them, and I okay, so yeah, in future, one day maybe I'll be like them. So I will have all kind of just in me, so I can like I'll have that confidence to face any kind of patient. So that was the most inspiring thing I ever had when I started. Yeah, I mean there were some ups and downs that was there, and that is common in any kind of student's life, so that was fine. That's what I feel like. The initial impression the ISIS staffs and everyone they have put, they had put like that was quite inspiring for me. That's good. So I don't know how 5 years went by. Just too quick. But yeah, so when I finished my course and I was thinking doing my internship, I don't know why I went to Bangalore. Actually, to be frank, I had a senior like who was an immediate senior. He suggested me like don't like why don't you come here because I'm practicing. I know like the way they practice, like you find it in. So I don't know. I just blindly packed my luggage and left to Bangalore. I roamed around and saw a few hospitals and applied for internship those hospitals. Finally, I did. intensive in mental college in one of the biggest hospitals in Bangalore. So yeah, I did my internship for 6 months. A job there. I started working for 2 years. Then I skipped to another hospital, St. Martha's. So yeah, one of the fun thing I have experienced, like which like reminded me of my first year, was during the first 2 years of my practice, I was doing a lectureship in a college. It was part time actually. So yeah, when I started teaching students, that time I realized, okay, the feeling my teachers had during when I used to approach them with some doubts. So it was very inspiring. So I found that like my profession is like quite way beyond the noble. Like we're definitely helping a needed patient, rehabilitation stuff. And yeah, so it's also like creating a opportunity for people, for students like who want to build a good career in their life. Yeah, I was practicing in Bangalore for 6 years. Simultaneously, I was like preparing preparing for higher education. I had two countries in my mind: UK, Australia, and Canada. I think I got first response from the UK, so blindly I took the offer and came here. And obviously, there were a few other things, scholarship stuff, which like inspired, which made me pick UK compared to the compared to Australia and Canada. I feel this is how it's been going. So last 1 year, I recently completed my dissertation and started practicing here for the NHS. Smoothly, let's see how it goes. Up to you, Priyanka. Priya. I think your mic is muted.
Yeah. Okay. Thank you. Like you, I think you have cut sorted and you have told us. Anyways, I would like to request you to talk a few things about like your experience or what you enjoyed at IHS and how did you feel at IHS
Yeah,
about your teachers maybe or what exposures you got, maybe conferences you attended or anything which you still remember and it has engraved in your memories for a long and it will be with you for your life maybe. So if you would like to share a few things about that to our participants or my students.
so I'll be glad to say that because it's not just one. So many incidents happened like which had put good impression in my mind regarding my. Yeah, yeah. If you talk about like conferences and what can I say, conferences or any webinars and stuff. Yeah, of course. Like I just had conducted a many conference. We conducted my during my days also conference. So yeah, like that gave us one opportunity to like know different knowledge background. It was inspiring. Those were good. Those conferences were really inspiring. And about my lectures and stuff, oh my God, they are really good. I have no complaint. I had no complaint. Yeah, sometimes I had this like student attitude, like competitive attitude. Yeah, that made us chase behind the lecture with doubts, like we go to them. They were like very keen and when they answered my question. So obviously that was very inspiring. And if I talk about the management, yeah, the management is very helping. I believe because recently for my registration, I needed a bunch of documents. There's a big headache. I just family I just told principal sir and So you don't have to out all the doubt. Yeah, of course, like about my institute, I have all feedback. So if you compare to other private institutes, yeah, I have friends like passed out from institute. They all praise IHA. I believe like yeah, one of the best institute private sector in Odisha, you can say. So I guess there are so many other things. If I start saying about it, it won't be half an hour won't be enough.
You can add few of them if you want to. Like if really they are interesting for our kids to know, and it must be inspiring too. So you can at least add few more.
Ask me about like how is the institute. Obviously, I have like a lot of good feedback about it, such as just as a, I just told right, like about helping. Like even though I'm out from the institute, it's more than 7 years, so my institute still care for me. So said my problem and told sir that said these are the documents I need for the registration. Even I'm a professor, so he directly like told principal said to take care of the issue. So yeah, institute wise, like I have never seen any like once you are out of the institute, they don't care of the students. So they have been helping a lot from the last couple of years regarding translator, reference from people and like which I need for my professional. So yeah, that was completely like say yeah, my institute like other institute definitely they help me and yeah yeah I believe like study wise also like, good exposure during my graduation days overall like everything so it was yeah it was good like yeah even I had a few of my let's say a few of my friends who were from other institute they had complained that they didn't go for different classes and stuff. We were very lucky that we got a chance to do our anatomy stuff and the back in SCB. So they tried to help us to the max. So uh, first it is one of the best, and I believe that. Yeah, I'm thanking
Thank
them.
you. And a few more things. And if you could like talk about few more things, like how did you feel when you joined physiotherapy as a like professional subject at Institute of Health Sciences? And
That's the
how
thing.
was your journey? And how did you do?
Yeah.
Yeah.
So when I joined, I just so luckiest part my batch ever had was like we got a chance to get involved in the clinical practice. Like we had this thing like morning, we had a couple of classes. Um, then whenever we had free time, we go and see the patient being treated by staffs or see the students. So that kind of inspired us. Then we thought, okay, such kind of patients like who are in the high, like uh, different grades of cancer, we are helping them cover and stuff. So professional when I saw those things, it inspired me a lot. Like, yeah, in future I am going to be one of them, like who will be helping people out come out of their. So yeah, professional physiotherapy is way beyond a noble profession, and I'm very I'm very happy to say that now almost every state, including national level, they have started recognizing physiotherapy and started building different councils for the like, for the better professional development. That's really inspiring.
Yeah. Uh, Would you like to talk about anything else?
I'd like to add something more about my profession. Uh, when I was in Odisha, I was thinking, uh, yeah, the way me and like we students, final students, and my staffs we used to support the foreign country, making people understand the importance of physiotherapy and those like the first decade of 20th century and now the end of the decade to start the third decade. So it has a lot. People started recognizing and the importance of physiotherapy in their everyday life. Yeah, that's a good thing for us that uh, yeah, because we used to spend a lot of time convincing that yeah, it takes time. You can get stroke patient get result within a couple of weeks and stuff. You have to take a prolonged treatment. It's a mild improvement in their symptoms. Um, so counseling was a big part in all. We had to counsel the patient. They had to make them understand what's going on, how long the process takes. But nowadays people know that earlier. So when people approach to me and ask, they says, "I know, sir, this is going to take time. I hope no, you help me out." That makes me feel more like he already knows that like, this kind of situation takes time. So that shows that people are now aware about the and like and how physiotherapy can. That's good. It changed a lot.
Yeah. Yeah, thank you. So you told about something about physiotherapy. Like it's true. Now, like I have been working quite a long time in Orissa in the same profession as yours, and we have been seeing a very good changes and great opportunities coming up for everybody. Those who are looking into to be a part of this profession. Of course, I would say that I'm proud to be a part of this profession and even part of Institute of Health Sciences. As you are also saying the same, I have been acquainted with Institute of Health Sciences for quite a long time now, and it's really good working here because the focus area is basically on upliftment and development of each and everybody who is associated here. Even the faculties get opportunities and students too. And being a faculty here, we are working into more so that we can focus upon how students overall career building can be done.
That's
So
great.
like during yeah, so I think we can sum this session up, and it was really nice talking to you, and we would like to have few more sessions like this on and off, and if you could put highlights on your topics also, it would be great. We'll be in touch. uh,
So
Thank you for sparing your time and coming. And
yeah, so even I believe like such kind of like webinars will be helping out like for our students even professionals to have a discussion about different topics like upcoming topics. So that's a good thing. I just started one of the good thing. Yeah, up to you, Priya.
yeah, thank you everyone for your yeah, thank you everyone for joining us on the live session for with our alumni, and we are really proud that our alumni is now working, has completed his MS in sports from UK, and he is working there with NHS. So it's really a pride moment when a student goes up so high that we can be known by their names. So thank you, and thank you for everyone who have joined us today. And we have many more alumni like that, and we will be coming up with more of alumni talks in this way. Thank you. So we close the session now. Thank you, everyone.